The first question was, can you describe the reality in the hospital and ICU unit? Many people don't see full waiting rooms, and the perception is that case numbers are being inflated. This person wrote, the hospitals here are filling up. Working in ICU, I'm not sure about what the emergency room waiting rooms and what wait times are like, but our inpatient units, admitted patient areas are filling up. The ICU specifically has opened up more beds than we normally have by fitting more beds in each room. So technically, we aren't full in brackets yet, but the number of patients in there is higher than we normally hold. A lot of these COVID patients are transferred over from the Toronto area. It sounds great that we aren't full, but we are struggling to staff these beds. The hospital has been very supportive on frontline staff and helping out whenever we need it, by sending us more nurses to help. But the issue is ICU needs specially trained staff. So these nurses they're sending can only do so much. Never thought of that.
Me neither.
Each ICU nurse typically has one ICU patient to one nurse, but now most ICU nurses are doubled with 2 ICU patients and have a buddy, so non-ICU trained nurse, to help them out in any way they can. Basically, although the hospitals in Ottawa aren't bursting like they are in Toronto, the ICU is starting to fill up with those Toronto patients, and the front staff here in Ottawa are starting to feel the pressure daily. I have a friend that works in Kingston Hospital ICU, and they typically carry 32-ish patients in their ICU, and now they have 66. Majority of these patients are Toronto patients requiring ICU, and now they're coming here to Ottawa. It's only a matter of time before we are way over our capacity too. So that was something that really opened up my eyes.
Wow.
In terms of transferring, right? Like this is a provincial conversation, not just a city one.
Yeah, because it also makes me think now, with everybody saying our hospitals are flooded, we need to shut Ottawa down. Now, is it from Ottawa or is it from Toronto? Are hospitals stacked from Toronto? I'm not saying most, like the entire hospital, but I'm guessing, like I'm trying to wonder if it's the majority of the ICU.
It sounds like it. It sounds like it. It sounds like the hot spots are in Toronto, and they're relocating them.
I'm not gonna say this hasn't been talked about in the media at all, but I definitely have not heard about this.
Me neither. I haven't heard about it at all.
This is my first time hearing that there are Toronto patients being transferred from Toronto to Ottawa.
Yeah.
And nobody's talking about it.
Yeah. I mean, redistribution of resources is a good idea.
Of course.
I think that it makes sense, but I raised an eyebrow and I sent a follow-up question and I asked, are these Toronto patients being kept in quarantine the entire time? Do they ever have any contact with the city of Ottawa? Once cleared/healed, are they then transported back to their town?
Solid question.
Our source confirmed, yes, these patients and any patients with COVID are kept in isolation. They do not have any contact to the city or individuals aside from staff in PPE. Once they're recovered and don't require ICU, they will be transferred back to Toronto or wherever they came from. We have not transferred any patients out as we just started receiving them recently and they haven't recovered yet. But I have heard from a close source that works for the local hospital with patient flow discharge planning. She said that the hospitals have been paying for transfer services back and that the hospitals get compensated by the ministry. Okay. There was a recent article released by CTV News. She shared the link that a Toronto family was left to pay for their loved one's body to be transferred back to Toronto. I'm not sure what happened there, but since we haven't been in the position to send anyone back yet from our department, I've heard the transfers back are covered at the expense of the ministry, which should be the case.
Yeah.
It's a public health,
Of course. Yeah.
concern. But apparently, there's one story here: Toronto family forced to pay to bring back uncle's body back after hospital transfer to Ottawa. Imagine that.
Man.
Imagine that, hiring a private company. The uncle had to pass away alone in another city, only for the family to have to cover the expense of bringing him back.
Oh man, and I would love to emphasize the word alone.
Alone.
Oh my God.
Nobody there. Yeah, it's so sad.
I have I'm not gonna say names, but somebody that I know, and his father was in the ICU recently for COVID, and he was finally recovering, but he was so sick and tired of sitting on that bed that he just started to unplug himself. Like he just wants to get up and move, because he's been sitting on that bed for like 9+ days, 10 days.
100%. I totally agree with that.
And then imagine,
I don't agree with it, but I totally understand where you're coming from. Because I'm sorry, just real quick, I tried to escape the hospital when I was in ICU, which is really amazing. I don't know why I left that detail out when I was explaining it to you. My uncle caught me at the door. I had the IV. I was rolling the IV with me. I was out. I was done. Sorry, go on. Continue.
And so now imagine you knowing your father's in the ICU, you receive a phone call, or one of the family members receives a phone call from the hospital asking for permission to strap him to the bed for his own protection. So he doesn't get off the bed. Because they have to keep him monitored, right?
Right.
He can't keep getting up and stuff until they tell him to do so. But like, tough times, man. Like I would.
Now take that scenario that you just described and put it in another city. Imagine him going through all of that
somewhere else
and alone. Imagine not having access to your loved one.
Yep.
The person both receiving the treatment and the person related to that person that can't be with their loved one. It's crazy.
It's insanity.
It's really hard to deal with. So I'll continue on here. The hospital has also stopped doing surgeries other than emergency surgeries or C-sections to help alleviate the need for more beds, which has helped a lot. But the public wait times for hip replacement or whatever else has now increased even more. Canada healthcare system was already rated poorly because of its long wait times for healthcare services. So imagine how many years it will take us to recover from this pandemic and catch up. Bro, I never thought of that. The ripple effect of all of the procedures that are being backed up. It's going to be insane.
Now take that thought and put it towards everything else that's happening wrong in Canada. That is also going to ripple effect everywhere.
Oh, you mean like the mental health, depression, suicide?
Economy-wise, everything.
Economy, businesses.
Now, 100%. Of course, this is one of the most severe ones, because those surgeries where you have to wait for a doctor, a special doctor, to be able to operate on you for whatever reason. Now there's going to be a massive lineup, twice as long. Not 100%. A lineup, a wait time.
No, I mean, I like, it's true. The already when things pre-COVID, like when things were great, it was like average 6 to 8 hour wait for an X-ray.
My cousin had acid reflux and he had to get surgery for it because it was so severe. 3 months wait. Now imagine if somebody has the same issue as him, how long they're going to have to wait after COVID. That's just an example. We're talking about a time where nothing was wrong and you can go to a hospital freely and wait a normal amount of time. You know what I mean? And for special surgeries like that, where I had to take 3 months for you to actually get a spot, and that was normal, just literally process in your mind how long it's going to take in the future to go at a surgery like that.
So they continue, this pandemic has not put a strain on our healthcare system just now, but also for the years to come, and backlogged surgeries and non-urgent services. Absolutely. Never ever thought of that.